Hello everyone, my name is Awad Ahmed and today we will discuss our case of chronic cholecystitis. Okay, now I would like to begin by clarifying the term of cholecystitis. Cholecystitis, we have two types, acute cholecystitis and chronic cholecystitis. Now we will define the chronic cholecystitis because our case. Chronic cholecystitis is long-term inflammation of gallbladder that's usually caused by repeated episode of gallbladder inflammations. Okay, now we will move to the patient medical. A patient diagnosed with chronic cholecystitis, the patient when she admitted to the ER complaining from right upper quadrant abdominal pain with nausea and vomiting for signs and symptoms. She has an announced history of drug allergy and a surgical due before 20 years old for appendectomy and before 10 years old for tonsillectomy. Now we will move to the definition of the case. 56 years old woman present with abdominal pain, and we have the pain. She have the pain worsen after consuming fatty foods. Why the pain increasing when she consuming fatty foods? Because a pile help in digestion of fats. When a patient consumes fat food, that will be lead to difficult to digest and increase the pain. And the pain score was 7. I'm Rad Ahmed. After we talk about basic medical introduction and we know the cholecystitis and the difference between them, let's talk about the causes of disease. We have here four most common causes. The first one is gallstone. Gallstone can block the cystic duct. This blockage leads to build up of bile, causing inflammation and infection. The second one is bile differentiation. Blockage of the bile duct caused by stone. And third one is infection. Gallbladder swelling and irritation can result from AIDS and viral infection. The last one is severe illness. Reduces the blood flow to the gallbladder and damage to blood vessels. Can cause a gallbladder swelling and irritation. And we collect the history for this patient. The patient has a history of appendectomy and tonsillectomy and sleeve gastrectomy. The patient is obesity, that is a risk factor of gallstone, and past medical history, surgery and stabilization appendectomy for 20 years and hysterectomy for 10 years ago. The physical examination, we have two subjective and objective data. The subjective data, patient say, I have abdominal pain in the right upper quadrant, and we take the vital sign is normal, and we check blood count, white blood cells, red blood cells, and we check the liver function test and do morphine sign. Thank you for listening.
Compare the finding of the patient to the textbook finding. Chronic cholecystitis typically has normal vital signs. The patient experiences intermittent variable intensity pain in the right upper quadrant or epigastric region with moderate to severe discomfort, indicating flare-ups. They report 7 out of 10 pains, which are typically a common symptoms. Medical and surgical management through abdominal examination, including CBC and liver function test, is necessary before undergoing laparoscopic cholecystectomy. Nursing management include monitoring for dehydration and pain management.
So let's move to the actual nursing diagnosis. The first one will be the acute pain related to surgical intervention, laparoscopic cholecystectomy, as evidenced by patient report of pain 7 out of 10, and description of pain characteristics. The second one will be the unbalanced nutrition. It's the body does not get enough nutrient from chronic cholecystitis because of nausea and intolerance to high-fat food. And the patient need to avoid foods due to worsening symptoms. Decreased appetite and nausea report serve as evidence of this. The risk nursing diagnosis. We have risk factors include the possibility of bacterial colonization, chronic inflammation of the gallbladder tissue, and the development of acute cholecystitis. These nursing diagnoses concentrate on managing pain, dietary difficulties, and possible side effects that may result from persistent inflammation of the gallbladder. In conclusion, the experience of this experience improved practice by emphasizing the psychological and emotional effect of chronic illness. And I'd like to thank my colleague and Dr. Dalia, and that's our presentation. Thank you very much.